What if a simple nosebleed was more than just dry air or a scratch inside your nose? What if it was your body's way of warning you about high blood pressure? Every year, millions of people get nosebleeds, and for most, they're harmless. But here's the big question. Can nosebleeds really mean you have high blood pressure, or is that just a myth? In this video, we're going to uncover the surprising truth. You'll learn why nosebleeds happen, whether they're truly linked to hypertension when they might be a red flag, and most importantly, what you should do if they keep happening. Stay with me until the end, because knowing the facts could save you from unnecessary worry or even from ignoring a serious warning sign. Understanding nosebleeds epistaxis. Nosebleeds, also called epistaxis, are incredibly common. In fact, nearly everyone experiences at least one in their lifetime, and most people never think twice about it. But to understand whether nosebleeds are truly linked to high blood pressure, we first need to know why they happen in the first place. Why the nose is vulnerable. The inside of your nose is lined with tiny, delicate blood vessels that sit very close to the surface. These vessels are fragile and can rupture easily. Because the nasal passages are exposed to air, dust, bacteria, and constant airflow from breathing, they're more prone to irritation and dryness than many other parts of the body. Types of nosebleeds. Anterior nosebleeds. The most common type, where bleeding comes from the front part of the nose. These are usually mild and stop on their own. Posterior nosebleeds. Less common but more serious. These occur deeper in the nasal cavity, often leading to heavier bleeding that can flow into the throat. Posterior bleeds may require medical attention. Common causes not related to high blood pressure. Most nosebleeds are not linked to hypertension. Instead, they often result from dry air, particularly in winter or in air-conditioned rooms, nasal trauma, picking the nose, blowing too hard, or minor injuries, allergies and infections, inflammation from colds, sinus infections, or seasonal allergies, medications, blood thinners, aspirin, or frequent nasal sprays can make bleeding more likely. Environmental factors, exposure to smoke, strong odors, or chemical irritants. For the majority of people, nosebleeds are not caused by high blood pressure at all. They're simply a result of the nose's delicate structure and outside factors like dryness or irritation. However, the story changes when nosebleeds happen often, last longer than usual, or appear alongside other troubling symptoms. That's when the link to high blood pressure becomes more important to explore. The connection between nosebleeds and high blood pressure. For years, people have believed that nosebleeds are a direct sign of high blood pressure. You've probably heard someone say, "Oh, my nose is bleeding. It must be my blood pressure." But is that really true? The answer is more complex than a simple yes or no. The theory: high blood pressure, or hypertension, puts extra force on your blood vessels. Over time, this pressure can make vessel walls weaker or more likely to rupture. Since the nose has tiny, fragile vessels right near the surface, it seems logical to think that high blood pressure could make them burst more easily. What research shows? Medical studies, however, tell a slightly different story. Most nosebleeds are not directly caused by hypertension. In fact, researchers have found that people with normal blood pressure get nosebleeds just as often as those with high blood pressure. So why the connection in people's minds? Because when someone with high blood pressure gets a nosebleed, it can be harder to stop. Elevated pressure can make the bleeding more severe or last longer, even if it wasn't the cause in the first place. The medical perspective. Doctors often say that high blood pressure and nosebleeds have more of an indirect relationship. Not the trigger. Hypertension doesn't usually cause the nosebleed. The amplifier. If you already have a bleed, high blood pressure can make it worse, harder to control, or more frequent over time. In rare cases, especially during a hypertensive crisis, dangerously high blood pressure, usually over 180 over 120 millimeters of mercury, nosebleeds can appear as one of the warning signs. But by that point, other symptoms like severe headache, dizziness, chest pain, or vision changes are often present too. A single nosebleed doesn't mean you have high blood pressure. But if you have frequent or hard-to-control nosebleeds, especially combined with other symptoms, it's a sign you should check your blood pressure and talk to a doctor. When a nosebleed could signal hypertension. While most nosebleeds are harmless and unrelated to blood pressure, there are situations where they should not be ignored. Frequent or recurrent nosebleeds. If you're experiencing nosebleeds regularly, several times a week or month, it could be more than just dry air or allergies. Repeated nosebleeds may point to an underlying issue, including uncontrolled high blood pressure. Severe or hard-to-stop bleeding. A nosebleed that lasts longer than 15 to 20 minutes despite proper first aid, or one that soaks through tissues and keeps flowing, can be a warning sign. High blood pressure can make blood vessels less stable and bleeding more difficult to control. Nosebleeds paired with other symptoms. The danger increases when nosebleeds happen alongside other red flags of hypertension, such as frequent headaches, dizziness or lightheadedness, blurred or double vision, shortness of breath, chest pain or tightness, unexplained fatigue. When these symptoms combine, the chances are much higher that high blood pressure is playing a role. Hypertensive crisis and nosebleeds. In rare but serious cases, a hypertensive crisis, when blood pressure spikes to dangerously high levels, above 180 over 120 millimeters of mercury, can trigger nosebleeds. This is a medical emergency. Other symptoms of a hypertensive crisis may include severe headache, confusion, trouble speaking, weakness or numbness on one side of the body, chest pain, or shortness of breath. If a nosebleed occurs in this situation, it is not the cause of the crisis, but a warning sign of severe underlying danger. Immediate emergency care is needed. While occasional nosebleeds are usually harmless, persistent, severe, or symptom-linked nosebleeds can signal poorly managed or dangerously high blood pressure. In these cases, checking your blood pressure and seeking medical advice is critical. Other warning signs of high blood pressure. High blood pressure is often called the silent killer. Why? Because in most cases it causes no symptoms at all until serious damage has already begun. That's why relying on nosebleeds alone, or any single symptom, is risky. Instead, it's important to recognize the other subtle warning signs that may accompany hypertension. 1. Persistent headaches. While not everyone with high blood pressure experiences headaches, severe or frequent headaches, especially in the morning, can sometimes point to elevated pressure in the blood vessels. 2. Vision problems. Blurred or double vision, spots in your sight, or sudden vision changes may result from damage to the tiny blood vessels in the eyes, a complication known as hypertensive retinopathy. 3. Dizziness and lightheadedness. Unexplained dizziness or feeling faint can signal that blood pressure levels are affecting circulation to the brain. 4. Shortness of breath. If climbing stairs or mild activity leaves you unusually breathless, it may be related to heart strain caused by long-term high blood pressure. 5. Chest pain or tightness. High blood pressure forces the heart to work harder, which can lead to chest discomfort or angina. Any chest pain should be taken seriously and evaluated immediately. 6. Fatigue and weakness. When the heart struggles to pump efficiently, the body's tissues don't get enough oxygen. This can leave you feeling unusually tired, even after adequate rest. Why this matters? The tricky part is that many of these symptoms are nonspecific. They could be caused by stress, poor sleep, or other health conditions. But when several occur together, or when they persist without explanation, they may point toward hypertension or its complications. The role of regular monitoring. Because high blood pressure is so often silent, doctors recommend routine blood pressure checks as the most reliable way to catch it early. Relying only on symptoms like nosebleeds, headaches, or dizziness can cause you to miss the problem until it's advanced. Nosebleeds are rarely the sole indicator of high blood pressure. Instead, it's the combination of symptoms, risk factors, and consistent blood pressure readings that reveal the true picture. What to do if you have nosebleeds. Getting a nosebleed can be unsettling, but knowing the right steps can make all the difference. Many people make mistakes, like tilting their head back, that actually make things worse. Here's how to handle it properly. Immediate first aid for nosebleeds. Stay calm and upright. Sit down and lean forward slightly. This prevents blood from flowing into the throat, which can cause coughing or nausea. Pinch the soft part of your nose, Use your thumb and index finger to firmly pinch the lower, soft part of your nose just below the bony bridge. Hold it continuously for 10 to 15 minutes without releasing it. Apply a cold compress. Placing an ice pack or cold cloth on the bridge of the nose can constrict blood vessels and slow the bleeding. Breathe through your mouth while holding pressure. Check after 15 minutes. If bleeding hasn't stopped, repeat the process. What not to do: do not tilt your head back. This causes blood to run into the throat and stomach, leading to nausea or vomiting. Do not lie flat. Staying upright reduces pressure in the nasal veins. Do not keep poking or blowing your nose right after the bleed stops. It may dislodge the clot and restart bleeding. When to seek medical help: you should seek emergency care if the nosebleed lasts longer than 20 minutes despite proper first aid, the bleeding is very heavy, or you swallow large amounts of blood, the nosebleed happens after a head injury, you have other symptoms like chest pain, dizziness, severe headache, or vision problems, you are on blood-thinning medications like warfarin, aspirin, or clopidogrel, which can make bleeding more dangerous. Checking blood pressure during nosebleeds. If nosebleeds happen often, especially alongside other symptoms, it's wise to check your blood pressure immediately. This helps determine whether hypertension might be playing a role. Most nosebleeds are harmless and can be stopped at home with simple steps. But persistent, severe, or unexplained nosebleeds should not be ignored, especially if you also have risk factors or symptoms of high blood pressure. Preventing nosebleeds and controlling blood pressure. The good news is that both nosebleeds and high blood pressure can often be managed and even prevented with a few simple lifestyle adjustments. Preventing nosebleeds. Keep the air moist. Dry indoor air is one of the biggest culprits. Use a humidifier during winter or in air-conditioned spaces to prevent nasal dryness. Moisturize the nasal passages. Apply a thin layer of saline gel or use saline sprays to keep the inside of your nose hydrated. Avoid nasal trauma. Resist the urge to pick or aggressively blow your nose, as this can irritate fragile vessels. Limit irritants. Stay away from cigarette smoke, harsh chemicals, or allergens that inflame nasal passages. Use medications carefully. Overusing decongestant sprays or taking blood-thinning drugs without medical guidance can increase nosebleed risks. Preventing and managing high blood pressure. Since high blood pressure can make nosebleeds worse, focusing on heart health is key. Some proven strategies include adopting a heart-healthy diet. Eat more fruits, vegetables, whole grains, beans, and lean proteins. The DASH diet is a gold standard for lowering blood pressure. Reducing sodium intake. Processed foods, canned soups, and restaurant meals often contain hidden salt that drives up blood pressure. Exercising regularly. Just 30 minutes of brisk walking most days can help lower blood pressure and improve circulation. Limiting alcohol and quitting smoking. Both habits directly damage blood vessels and raise blood pressure. Managing stress. Deep breathing, meditation, or yoga can reduce stress hormones that cause blood pressure spikes. Routine monitoring. Home blood pressure monitors make it easy to keep track and catch problems early. The double benefit. Interestingly, the same lifestyle changes that lower blood pressure also help reduce nosebleed frequency. For example, staying hydrated, avoiding smoking, and reducing stress protect both your nasal vessels and your heart. You may not be able to prevent every nosebleed, but by caring for your overall health, especially your blood pressure, you dramatically reduce the chances of nosebleeds becoming a persistent or dangerous problem. Who is most at risk for nosebleeds and high blood pressure? Not everyone faces the same likelihood of experiencing nosebleeds or developing high blood pressure. Some people are far more vulnerable because of age, lifestyle, or underlying health conditions. Understanding these risks helps identify when a nosebleed is likely nothing to worry about, and when it could be a warning sign that something bigger is going on. 1. Age plays a major role. Children and adolescents. Nosebleeds are common in kids, but in most cases, they are due to minor irritations like allergies, colds, or simply nose picking. The blood vessels in the front part of the nose, called Kieselbach's plexus, are delicate and easily injured. Importantly, these nosebleeds rarely have anything to do with blood pressure. Adults and older adults. As we age, blood vessels lose elasticity and become more fragile. This makes adults, especially those over 40, more prone to nosebleeds that are harder to stop. At the same time, the risk of high blood pressure increases significantly with age, making the connection between the two more relevant in this group. 2. People with uncontrolled or long-standing hypertension. If you already have high blood pressure, nosebleeds can become more problematic. While hypertension may not directly cause bleeding, it can make vessels more likely to rupture during everyday irritation, lead to longer-lasting and heavier bleeds that are difficult to control, turn a normally harmless nosebleed into a more concerning event. This is especially true for people who have had untreated high blood pressure for years, since their vessel walls may already be weakened by constant pressure. 3. Medication users. Certain medications increase bleeding risk. These include blood thinners like warfarin, heparin, or newer anticoagulants. Daily aspirin therapy, often prescribed for heart health. Anti-inflammatory drugs such as ibuprofen or naproxen, which can thin the blood when used frequently. When these medications are combined with high blood pressure, the result can be nosebleeds that are more intense and harder to manage. 4. Smokers and heavy drinkers. Smoking irritates and dries the nasal passages, making vessels fragile. It also raises blood pressure and accelerates vessel damage, creating a double risk. Excessive alcohol use raises blood pressure and dilates blood vessels, which can make bleeding episodes more likely. People who drink heavily are also more likely to have liver problems, which impair blood clotting and make nosebleeds more severe. 5. Underlying health conditions. Several chronic conditions put people at a higher risk. Diabetes. High blood sugar damages blood vessels and often overlaps with hypertension. Kidney disease. Both a cause and consequence of high blood pressure, kidney problems make it harder to regulate fluids in vessel health. Liver disease. The liver produces clotting factors, so if it's damaged, nosebleeds can become more frequent and harder to stop. Blood clotting disorders. People with hemophilia, low platelet counts, or clotting problems bleed more easily, and high blood pressure worsens the effect. 6. Environmental and lifestyle factors. Sometimes risk has little to do with illness and more to do with the environment. Living in very dry climates or using indoor heating and air conditioning dries out nasal passages. Add uncontrolled blood pressure to the mix, and you have a higher chance of troublesome nosebleeds. People with high stress levels, poor diet, or lack of exercise also face higher risks, since these factors drive hypertension. 7. Family history and genetics. If high blood pressure runs in your family, you're already more at risk. Combine that with naturally weaker or more sensitive blood vessels in the nasal passages, and you may be more prone to nosebleeds as well. What this means in real life. If you belong to any of these groups, it doesn't mean every nosebleed is dangerous, but it does mean you should be more cautious. Occasional light bleeding from the nose is still common and usually harmless. But if you're older, on medications, or living with conditions like hypertension or diabetes, repeated or heavy nosebleeds should never be brushed aside. The link between nosebleeds and high blood pressure isn't simple. For most people, nosebleeds are harmless. But for those at higher risk, older adults, hypertensive patients, smokers, heavy drinkers, and people with chronic conditions, they may be an important red flag. Paying attention to these risks and staying consistent with blood pressure monitoring can prevent minor issues from becoming life-threatening ones. Conclusion. So, can nosebleeds really mean high blood pressure? The truth is this. Most nosebleeds are harmless and caused by things like dry air, allergies, or minor irritation, not hypertension. But high blood pressure can make nosebleeds harder to stop, more frequent, and, in rare cases, a warning sign of a hypertensive crisis. That's why it's so important not to ignore the bigger picture. A single nosebleed isn't usually a cause for panic, but recurrent, severe, or hard-to-control nosebleeds, especially when paired with symptoms like headaches, dizziness, or vision problems, should push you to check your blood pressure. Remember, high blood pressure is called the silent killer for a reason. It often gives little to no warning until damage has already been done. That's why routine blood pressure checks, a heart-healthy lifestyle, and early medical advice are your best defenses. So the next time you or someone you know gets a nosebleed, don't jump to conclusions. Instead, take it as a gentle reminder to stay on top of your health. Your heart, your brain, and your blood vessels will thank you. If you found this video helpful, don't forget to hit the like button, share it with friends and family, and subscribe to the channel for more doctor-approved, easy-to-understand health tips. And let me know in the comments, have you ever worried that your nosebleeds were linked to blood pressure? Thank you for watching, and remember, small steps today can protect your health for years to come.